Thanks for listening to this recording on adolescent sexual health history taking and sexual health anticipatory guidance. This presentation includes a background on adolescent sexual health epidemiology, a review of the CDC's guide to taking a sexual health history, a review of recommended sexual health anticipatory guidance for adolescent well-child visits, and overall, an increased provider comfort in obtaining a sexual health history and increased provision of sexual health anticipatory guidance during adolescent well-child visits. For some background regarding sexual health epidemiology in adolescents, adolescents represent 12.9% of the U.S. population, but represent 50% of new STI cases. For this reason, they're at the highest risk for contraction of STIs. From that, the United States spends $15.6 billion annually in the treatment of STIs. Looking more specifically at Indiana STI statistics, Indiana has the highest rate of STIs in the last 5 years. Of such, from 2014 to 2018, there was a 19.4% increase in chlamydia cases and a 54% increase in gonorrhea cases in the state of Indiana. Now to consider the epidemiology as it relates to pregnancy in adolescents. The United States has the highest rate of adolescent pregnancy of any industrialized country. Looking specifically at Indiana, teens 15 to 19, the pregnancy rate is 21.8 per 1,000 women. In comparison to other states, Indiana is ranked 38th in the nation for teen pregnancy, with 1 being the lowest pregnancy rate and 50 being the highest. In considering primary care's role in the care of sexual health in adolescents, only 20% of primary care providers routinely provide reproductive health counseling to adolescents, despite governing bodies such as the American Academy of Pediatrics, the American College of Obstetricians and Gynecology, and the Society of Adolescent Health and Medicine recommendations. And finally, state and federal laws also support confidential sexual health services in the primary care setting. There are many confounding factors that may make the implementation of adolescent sexual health services difficult for providers. The first may be the provider's own bias. The provider may feel that the adolescent behavior is inappropriate. In this situation, the provider should consider risk reduction and their professional responsibility to the adolescent rather than their judgment on the adolescent's behavior. Additionally, lack of knowledge as it relates to adolescent sexual health may cause the provider to feel uncomfortable. In this situation, further education surrounding these topics may be helpful. Further education will be provided in the following slides, and additional resources will be provided at the end of this presentation. Additionally, providers may feel uncomfortable discussing adolescent quiet personal time with the provider with parents. A helpful tip when doing this is to set the expectation early, around 11 or 12 years old, discussing the transition into adolescence and the need for adolescents to take responsibility for their own care as they become adults. Additionally, it may be helpful to routinely screen for sexual health risks to make the provider feel more comfortable. And when talking to adolescents, it's important to be honest and direct so that they feel comfortable in being honest with you. The American Academy of Pediatrics recommends the implementation of confidential times with adolescent patients during well-child visits starting at the 11-year-old well-child visit. A way to frame this to parents include discussing how children, as they become adults, must take more responsibility in their care, and this is a way to help transition them into taking responsibility for their care. The CDC's Guide to Taking a Sexual Health History was developed as a tool for providers for assessment of risk as it relates to sexual health. It also helps providers have verbiage to best navigate conversations with adolescents as it relates to their sexual health practices. The CDC's guide follows the 5P method, which will be in the following slides, but include partners, practices, from STDs, past history of STDs, and the prevention of pregnancy. The CDC recommends that the conversation starts and the provider ensures that the provider asks all patients that are this age these questions, and additionally that these questions will remain confidential. The provider explains that these questions are sensitive, but they are needed to help screen for the risks of STD exposure and unintended pregnancy. Now for a review of the 5 Ps of sexual health history taking. First, partners. The provider should inquire about: has the patient been sexually active ever or in the last 12 months? If so, how many partners? And was the person sexually active with males, females, or both? Next, the provider should explain that they must ask further questions to help understand and assess the patient's risk for STI exposure. The provider should then ask if their sexual contacts included anal intercourse, vaginal intercourse, or oral intercourse. The provider should then assess for protection from STIs. The provider can ask, are you using any form of protection against STIs? If so, how often? The provider should then ask about a past history of STIs. Have you ever had a STI? Do you have any recurring symptoms of STIs? And at this time, it is appropriate to offer STI testing. Finally, the provider assesses for pregnancy prevention. The provider asks, do you have any plans to become pregnant? Are you concerned about any unplanned pregnancy? Do you use any form of birth control? And at this time, it is appropriate to offer birth control options. In accordance with the screening, the anticipatory guidance follows: pregnancy prevention and contraception, STI prevention and correct condom use, HIV testing and treatment, and preconception health. Additional resources that can be found online in regards to sexual health in the adolescent population includes free CME online modules from the American Academy of Pediatrics regarding affirming medical care for LGBTQ adolescents, confidential adolescent care and billing, and Let's Talk About Sex, which is a module that addresses the beginning to end of a reproductive health visit for an adolescent. Additionally, the American College of Obstetricians and Gynecology has clinical guidance in regards to adolescent health visits. Finally, the Society of Adolescent Health and Medicine provides free access to the adolescent medicine resident curriculum and has specific sections on sexual and reproductive health. Thank you for listening to this presentation, and please follow to the next screen for the post survey. Thank you for your time.